Hello dear viewers, in this video I will discuss what is fast HUGS in bed please, how this mnemonic is useful during the care of critical patients, how practicing it will take the care of your patient to next level. I am Dr. Sunil Garg from Essentials of Acute Care. What are fast HUGS in bed please? Regardless of the underlying cause of the illness, the provision of meticulous supportive care is essential to the management of critically ill patient. Back in 2005, Jean-Louis Vincent popularized the fast HUGS mnemonic for recalling the key issue to review when looking after a critically ill patient. Give your patient a fast HUGS in bed please at least once a day. F means feeding and fluids. Decide during round about feeding and fluids, when to initiate or change, how much to initiate or change, if there need to change type of fluid, check gastric residue, urine output, presence of vomiting, nausea, regurgitation, abdominal distension, check electrolyte and pH. A means analgesia. Look at pain score chart, titrate medication according to goal, review medication, assess organ functions, check whether there is need for frequent neurological assessment. S means sedation and S means spontaneous breathing trial. Whether patient is comfortable or in distress, whether cause of distress is anxiety or fear, sedation goal, selection of agent, dose titration, heart rate and blood pressure, whether patient is on ventilator, whether patient is receiving any vasopressor, check whether there is need for frequent neurological assessment, check whether underlying cause of ventilation has recovered or improving, check and change ventilator settings accordingly to decide about weaning. T means thromboprophylaxis. Decide during round about need of thromboprophylaxis, any contraindication or limitation to prophylaxis, underlying condition, whether post-operative patient, trauma patient, joint replacement patient, or a patient is a medical. H means head up position 30 to 45 degree if patient is intubated and there is no contraindication like thoracic or lumbar spine injury or surgery. Patient is not hemodynamically unstable. U means ulcer prophylaxis. Check what is the risk of stress ulcer, whether patient is severely ill and on vasopressor, whether patient is in respiratory failure and on mechanical ventilator, or with neurological injuries and unconscious, or receiving non-steroidal anti-inflammatory drugs. G means glucose control. Check whether patient has persistent hyperglycemia irrespective of diabetic status, whether patient is surgical patient or medical patient. S means skin care, eye care and suctioning, whether patient is unconscious and on sedation or paralysis, what is the nutritional status of patient, age of patient, quantity of secretion, any bad wetting or increased frequency of stool. I means indwelling catheter, whether patient continues to need catheters like urinary catheter, arterial catheter or central venous catheter, or it can be removed, whether catheter insertion sites are clean or not, or there is redness, pus or evidence of ischemia or infection, whether dressing is damped, whether transducer level is appropriate, zeroing done, whether arterial tracing is over or under damped. N means nasogastric tube, whether patient needs NG tube or can have orally, NG tube position is in place, is there any feed regurgitation, whether NG tube is functional. B means bowel care, any constipation or loose motion, whether patient is receiving any laxative or antibiotics, likely cause of abnormal bowel movements. Environment, E means environment, temperature control, appropriate surroundings in patients with delirium, what is patient temperature and room temperature, whether patient is comfortable, is there any neurological injury, whether daylight is adequate and environment is noise free. D means de-escalation, de-escalation of antibiotics and of life issues and treatments no longer needed, whether antibiotics can be de-escalated, whether organism or source of infection identified, whether the organism identified is real culprit or contaminant colonizer, review patient treatment and check whether any medication is there which is no longer necessary or dose needs to be modified, whether treatment needs to be comfort care in view of terminal illness. P means psychosocial support, psychosocial support for patient, family and staff, whether patient, family or staff is in distress, whether patient or family is well communicated regarding plan of care and prognosis and they understand it and agrees to it, whether patient autonomy is protected. These questions we should ask daily during the round to improve the care of our critically ill patients. Here I finish. If you have any feedback, suggestion or comments, please write in comment section box. See you with my next video. Till then, bye and take care.